Now, members of Congress, especially you Republicans, you have a solemn duty and a responsibility to know the impact and consequences of the laws and policies they enact and the reforms that they push.
That's right.
Quite frankly, this is a pretty basic and low expectation. So how is it that we as healthcare and hospital workers find it necessary to ask Republican members of Congress today while they are back at home, what's your plan?
Right.
And just in case you can't hear us, we're gonna need you to read us. What is your plan?
Right.
It is deeply troubling to me that after all these years that the House Republicans who voted to appeal the Obamacare over 60 times have yet to reveal to the American people, to us, what their intentions are. What are they going to do about fixing our health care problem? It is irresponsible and immoral for Congress to vote to repeal the Affordable Care Act without having a better, more affordable, and more accessible plan in its place.
Right.
And it is ridiculous not to release their plans to the American people.
That's right.
People's lives are hanging in the balance.
That's right.
Right now, there is no plan from this Republican Congress, but there is an agenda. Now that agenda is to destroy the safety net that supports and provides care for low-income families, children, adults, people with disabilities, and most of all, our seniors. And they don't deserve it. We don't deserve it.
Right.
So I ask you again, Republican Congress, what is your plan? Now this agenda is to turn our healthcare system back over to insurance companies and corporate interests without any rules or accountability. How else are we to think otherwise? We can see and debate Congress replacement healthcare law. Republicans suddenly say they care about our economy, but we know that's not true because they don't have nothing in the works, nothing a plan up. So yet repealing the Affordable Care Act will cause 1.2 million Illinoisans to lose health insurance coverage, and is estimated to cost Illinois 114,000 jobs by the year of 2019. Now this isn't conservative, this is just a straight up con.
Right.
That's all it is, it's a con. So we have come too far and fought too hard to go backwards. Make healthcare a right. As healthcare and hospital workers, we are committed to protecting healthcare for the families and the communities whom we faithfully serve, and we will keep fighting because we do it best.
Right.
We know how to fight. Now, my grandmother told me a long time ago, if it ain't if it ain't broke, don't fix it. So I thank you very much. Let's begin to fight. What is your plan, Congress?
Yeah.